Welcome to Is Your Liver Healthy with the Global Liver Institute. I'm your host, Jeff McIntyre, and Vice President at GLI. Now, if you are joining us for the first time, this is a show for conversations around the big and the little questions around liver health. Now, that may sound a little niche to some, but those that work in the field know that liver health is a gateway to so many other issues we face as patients, as caregivers, and, well, frankly, as a society. Whether you're trying to figure out the best thing to fix for dinner, how to talk to your doctor, or what the latest in diagnostics or treatments are, we are here to learn from each other over the course of this monthly program. Now, last month, Global Liver introduced the latest edition of our Global State of Liver Health Report. And this is a great reference that gives us a chance to see what the extent of liver health issues are worldwide. We go nation by nation, eventually building a worldwide collection of where we stand on global liver health. Now, for instance, you'll see that one country had better success dealing with hepatitis, that's Egypt, while others are struggling with the rise in metabolic health concerns. And unfortunately, that's almost everywhere. So how do we deal with this? How do we come up with solutions in proportion to the seriousness of the problems that we face? Now, for this episode, I had the honor to speak with liver health leaders from around the world about their greatest challenges and what we can learn from each other to overcome those challenges. Let's get started. All right, thank you for joining us from here in Washington, D.C. to the other side of the world, which you two are definitely putting the Global Liver Institute today. So honored to have you join us. Why don't we start with your introducing a little bit of who you are and where you are right now. José?
Yeah. Hi, I'm José Willemse, and I'm for more than 25 years a patient advocate. I retired this year, but still very active. I'm in the Policy, Public Health and Advocacy Committee, EASL. Also a committee at ESPGHAN, that's the pediatric gastroenterology, and also board member of Liver Patient International. And I was the CEO of the Dutch Liver Patient Association.
Excellent. And you're coming to us from where today?
Where I'm based now?
Yes.
From Amsterdam. So
yeah.
We are still working on EASL, which is next year, 2025, in Amsterdam. So we're
Excellent.
really looking forward to that.
Great. And Laz, tell us a little bit about what brings you here today. Who are you, and where are you based out of today?
Yes, thank you, Jeff and José. I'm very excited to have this conversation with you. I'm Dr. Laz Eze. I'm a public health physician in Nigeria, and I work on different projects. I'm a health policy and management specialist, and my work has taken me to different disease programming, including liver disease. I'm also on the board of Lafia Wealth Initiative, and we've partnered with Global Liver Institute in marking the NASH days for at least 2 to 3 years. So I'm excited to be a part of this conversation. Thank you.
Yeah, thank you. Let's go ahead and keep with you, Dr. Eze. I'm wondering if you can talk a little bit about what are the main challenges with liver disease in Nigeria right now. The conversation we're having is because of GLI's release of the Global State of Liver Health Report. And so I guess the question really is, what is the state of liver health in Nigeria? Lagos obviously has one of the biggest economies in Africa. How would you consider it if you had to give it a grade? What is the state of liver health in Nigeria right now?
Okay, liver disease in Nigeria is a health condition that, we are not quite tracking, because before you could most accurately say the burden of a disease, you have to track it. You have to keep accurate research. So there are pockets of research here and there. There are pockets of data here and there, especially from tertiary health facilities, by some specialists who are working in this area, endocrinologists, internal medicine physicians, and people who have special interest in liver disorders. So, but, that does not accurately, project the reality of liver disease. But
Jose, let's go ahead and go over to you while we're having some connection issues, unfortunately. Talk a little bit about the Netherlands in this. As a European country, how would you consider the state of liver disease in the Netherlands? What are the challenges that you're facing there?
Yeah, well, I think like in a lot of countries, there's a lot of a lack of awareness. People don't know anything about it, so there's a lack of knowledge. And public health is an issue here, and also in general, but the focus is on what you say. Well, that must be liver too. It's very on cardiovascular diseases, on diabetes. Nobody speaks about the liver disease. And in the liver world, as we say that, in the Netherlands, so the hepatologists and the scientists and the patient organization, they are very active in trying, but on a governmental level, there's no attention. There's no attention. They are not aware about the problem that can be even bigger than the diabetes type 2.
I think that's probably, unfortunately, not unique to the Netherlands.
No, I'm sure about that. Yeah.
Throughout Europe as well. But I'm wondering if we can think about if there are things that have happened in the Netherlands specifically. Is there anything that you feel like you've done well? I mean, when I think of Amsterdam, I think of the Netherlands. Many of the social determinants of health that we talk about in the United States, of pedestrian infrastructure and access issues and stuff, aren't as big a concern, it seems. Are there things you feel like you do well in Amsterdam, in the Netherlands, that we can learn from?
Well, not on how you say that, the governmental level, but the patient organization and the hepatologists, the doctors and the scientists, they work very closely together. There's no doubt about that. So the patient organization is not involved in research, in campaigns, and we really are focusing on prevention but it's very difficult. But I think what we are doing now, and I see that worldwide, also with EASL, that we try to connect with the existing attention there is, like alcohol. That's really an issue all over the world. And then we say, hey, okay, we want to have also attention for the steatotic liver diseases, other liver diseases, but let's start with alcohol, because also the people in the government are now focused on the role of alcohol in a good way or a bad way. Sometimes it's not always the way we want, but then we connect, and then we hope that we can step by step convince them, like, hey, but the liver is very important and it affects the liver. But there is a lot of energy needed to go to get where we want to be.
Well, we know that, even though Netherlands may not be the largest country in Europe by mass, there's still a significant population there. How do you approach scaling solutions, if you will? And so you talk about, we can deliver these messages in the clinics one by one, but when we look at, say, population health, and we're really trying to solve the problem for the Netherlands, how would you suggest that we go about scaling solutions? What is the best avenue? Is it through the government? Is it through the healthcare system, through private entities? How would you suggest we scale?
That's a good question, but I think one of the most difficult questions. Our experience is not by the government. We had that experience with hepatitis C. And I think, and that's not typical Dutch, but I think that's
Right.
in other countries that the government say, well, that's a problem of the field, and who the field is, we assume the doctors. They have to solve the problem, and they don't see the need for more attention. There was no, like hepatitis C, there was no campaign from the government. We did everything by ourselves. We looked at the publicity, we did some, and then you reach something.
Right.
And now for the steatotic liver disease and other liver diseases and the prevention, I think it's almost it's not a frustration, because that doesn't bring you anywhere, but it's very difficult to find a way, like, hey, where can we put this on the map? Because what we see is obesity is on the map, and we have a lot of health programs like combined combined lifestyle interventions. We know that they don't work for a long time. The first year, everybody's very enthusiastic losing weight. The second year is less, and the third year, that problem is back. That's something, and that's reimbursed by healthcare insurance, by government, but especially for the liver. And we really want to have more awareness about the liver and the role of the liver and how important the liver is. But that's very difficult. I don't see that happening by the government. Besides that, people have a little bit resistance about everything that the government say that you have to do, because that felt for a lot of people, and maybe it's Dutch, I don't think it's Dutch, that it's like very paternalism. Is that good for that?
Yes.
So who are you to tell me what I have to do and I can eat and I have to work on? So I think it's just patient organization and the healthcare professionals, and slowly and hoping that we reach more people, and that we hope that also from political parties, people say, hey, this is interesting and very important. But as long as those parties have in their plans that hairdressers, shops for fashion can give people the bubbles, the champagne. Well, so where are we going to? And so things like that, because that's money for the government. And so it's a long breath, as we say, and we really need to continue and never give up. And I think we have to do it together. It's not one way to go. And it's almost my mantra. We have to do it together, and there is not one way. We have to take every way we see, and even the small parts, the big roads, doesn't matter. We take what we can take.
So let me ask you one last question here, which is, you and I have actually been through a lot together. And one of my valued friendships that I've made throughout working in liver advocacy as well. And in that time over the years, there's been a lot of changes. I do feel like there's been growth, there's more awareness and whatnot. So let's take that idea and expand upon it. If we are fortunate enough and say 10 years time from now, what do you think in the Netherlands are going to be the victories that we're celebrating in liver, and what are the challenges? So look into the genie's eyes, if you will, and tell us 10 years from now, what's this conversation going to be like?
Well, I hope that we can say that we save people. That we can save people from death. And that's really a very heavy sentence. But as long as we know that people have liver cancer, die from liver cancer, where the cause is, the steatotic liver disease or alcohol, and we can work on that people, and it's not that people don't want to listen, but they don't know. One of the Dutch doctors told me that he very often, if he tells people that they have liver cancer, and what probably the cause is, that they say, I have never known how bad alcohol was for me, or they told about my obesity that it was pretty bad for well, I could have diabetes and it will be very bad for my heart. Nobody spoke about the liver. I never knew that this was the liver. And I think that if we can reach more awareness, more knowledge, and that also general practitioners, but also in general, people take more care for their liver, and that we can say, hey, well, there are less people dying from this. Mm-hmm. Yeah, then we can say, well, you have never a success, because, but then we are on the good way.
Excellent. Well, José, thank you for joining us. We're sorry to see Laz drop off. Obviously, he was in the field in Nigeria.
I saw it well, but you manage another time with him.
Yeah, absolutely. But I think it really speaks to the global range of this issue. And we appreciate your time and appreciate your insight on this.
Always welcome. Always willing to help.
All right. We're back for part 2. They say the technology makes things easier, but it also has teaches us the virtues of patience in working with our partners throughout the world. Laz, thank you for rejoining us again for the release of our Liver Health is Public Health report from Nigeria. I'm so interested to speak with you because I feel like there's so much we can learn from your experiences. You know, we tried to connect with you the other day, and you were in a remote region there in Nigeria. I'm wondering if you can talk to us about liver health in Nigeria specifically. What are the challenges that you face in Nigeria, or that Nigeria faces when it comes to better liver health for your population?
Yes, thank you very much. Nigeria faces significant liver health challenge. Nigeria is a country with a lot of people, more than 220 million people, and high burden of non-communicable diseases, including hepatitis B, the various hepatitis A, B, C, D, E. In Nigeria, there's also relative high use of substances, alcohol consumption, tobacco, and other substances that could also harm the liver. So there are no, to my knowledge, specific policies that is targeting a promotion of liver health. We have health policies around immunization, which childhood immunization is quite strong, and the government is highly involved, providing vaccines free of charge. Of course, hepatitis B vaccine is one of the vaccines that are given at birth. So in terms of vaccinating children, Nigeria is making remarkable progress in that regard. However, in some parts of the country, there is inequitable distribution of these services. In some parts of the country, especially in areas where they may not get as much service of these services like others, or certain areas that security compromise, may also have challenge of these services. Also, diagnostics is not optimal. So in situations where people might have symptoms of liver disease, they probably may not get diagnosed on time. The health insurance doesn't cover more than 50% of the population, so it's majority of the people without health insurance coverage, and that limits the access to quality, preventive, diagnostic, or curative health services, generally speaking. And also specifically for liver care, you might need to check for liver function tests to diagnose tomography tests where they might be required. So these services are not equitably distributed, so you have significant number in the population that may not have access to these services, and that potentially impacts their liver health.
So I want to take this question and flip it around a little bit, because so often I think there is an emphasis. I think, unfortunately, there's an emphasis in the West to look at sub-Saharan, the continent, especially in terms of the problems that are faced. But I'm really curious, what can we learn? What are things, whether they're practice, their guidelines, their policies, what do you feel like Nigeria does well? What do you think that there are things that you feel like could be scaled up, that you feel like you've really got that, you have a good approach to be able to help that population?
Yeah, so thank you very much for that question. I think an aspect the country has done well is on childhood immunization. We have the routine immunization services, and apart from that, we have supplemental immunization, get immunized. And hepatitis B, being one of the pentavalent vaccines, is one of those vaccines that is given to children. So at birth is given with BCG, oral polio vaccine, and hepatitis B vaccine, and subsequently is given as one of the pentavalent vaccines. So the coverage has been sustained, periodically encounters certain challenges, but a lot of efforts, a lot of energy go into it. Policy-wise, there are substantial policies. The federal government of Nigeria have an agency, the National Primary Healthcare Development Agency, that is primarily responsible for the coordination, monitoring, and evaluation of immunization service delivery. Also at the subnational level, at the states and local levels, both the former and even traditional leaders, religious leaders, everyone is involved in immunization. So apart from that, the drugs, which is drug use, Nigeria has agencies of government that also control that. There's the National Drug Law Enforcement Agency that control, trying to limit the movement of illicit substances, which could harm the liver. The NAFDAC, the Agency for Food, Drug and Control, also, tries to ensure that alcohol is not sold to underage people, and the quality of the substance, any food that is being consumed, is of highest possible quality. There is work is being done at various levels. Awareness campaigns are being created, towards the control of or influencing people's behavior around the use of these substances that could harm the liver.
So, one last question for you here as we finish up. In 2024, Global Liver celebrated our 10th anniversary. So, if we look 10 years down the road, in 2034, in Nigeria, what are the victories in liver health you think you'll be celebrating? Let's talk in hope, in optimism, and in good work. What are the victories we will be celebrating in liver health, and what will be the challenges in 10 years that we'll be facing?
My opinion, this is going to I actually like working with data in making assessment of progress that is being made. But unfortunately, so far, right now in Nigeria, we are not consciously tracking liver-specific data, to say, okay, in terms of, fatty liver disease or alcoholic liver disease or non-alcoholic steatohepatitis, to be able to evaluate the progress that's been made in that regard. So without the data, I'm just going to make subjective assessment, based on, what I've observed. Working with the GLI, partnering with GLI, we've been able to try to create some awareness on NASH, non-alcoholic steatohepatitis. Of course, within the hospital settings, you get more cases of alcoholic liver disease, but not so much attention was being paid to the effect of obesity, diabetes mellitus, and other conditions that, could also affect liver health. So there is some increase in the awareness on NASH, and also without looking at liver specifically, some other the immunization campaigns also kind of improved over the past 3 decades, especially with the introduction of additional vaccines, hepatitis B vaccine, which, say, in the past 30 years, probably was not one of the routine vaccines given free of charge to children. But right now, for children under 5 years, is one of those routine vaccines that is given free of charge and paid by the government of Nigeria. So these are areas we find, environmental sanitation, also more awareness around it, and the fact that hepatitis A and can be transmitted fecal-orally. So with other benefits from hand washing campaigns associated with COVID-19 prevention, associated with prevention of Ebola, Lassa fever outbreaks that we've had in the country, so response to all of that kind of help to strengthen the public health systems, in terms of promoting environmental hygiene, which also, benefits liver health. So, but like I said, in terms of programming, we've not quite put liver specifically or kidney or any of some of these other organs, but there is a bit more attention on heart health, also attention on some other areas or NCDs generally. And in terms of infectious diseases, they are kind of largely put together and treated that way, as against looking at them from how they affect the respective organs.
Excellent. Thank you so much. Thank you for joining us. Thank you for your patience and your perseverance, both in our connection and in the great work that you do. Africa is a priority for the Global Liver Institute. I think it doesn't get enough resources, and it also doesn't get enough credit for the things that we can learn from the continent as well. And so we really appreciate your time and look forward to working with you more in the future as well.
Thank you, Jeff. I'm happy we're able to have this conversation.
All right, it is lovely, and I am privileged to sit down with 2 of our leading researchers in the area. Let's get started by actually having you introduce yourself. So, Hang, if you would talk a little bit about just who you are, what brings you here today?
Yes, so hello everyone. My name is Viet. I'm a lecturer in Hanoi Medical University in Vietnam. So in Vietnam, the doctor has to work pan-GI and hepatology. So that is why I work a lot with the viral hepatitis and liver cancer patients. So that is why I'm here to share about the situation and challenges in Vietnam now today.
Excellent. Professor El Sayed, joining us from Egypt. Tell us a little bit about your background and what brings you here today.
So I actually am a professor of pediatrics, and I started my career at the discovery of hepatitis C, and it was my doctorate thesis studying hepatitis C in children. And with so many studies and researchers, eventually I became a founding member for the Egyptian National Committee for Viral Hepatitis that was charged with all the elimination program for hepatitis. And I've seen hepatitis from inception to having the gold tier award on the pathway to elimination from WHO. So that's why I'm here today.
Excellent. Thank you for joining us. When it comes to liver disease, and perhaps this is me, but I feel like so often liver disease gets clumped together like it's one thing around the world. But we know that it can manifest in different ways in different countries, and different countries face different challenges with addressing them based on health systems, economies, political will, resources, all sorts of stuff. Dr. Hang, I want to go back to, let's start with you. Tell us a little bit about Vietnam. What are the challenges in Vietnam for liver health?
Yes, so coming back to Vietnam, we see that liver cancer is one of the burden for our healthcare system and for the society now, because it become the first rank in the prevalence and in the mortality rate of the malignancy. And when thinking about why we become like the second in the world with liver cancer, we found out that because mainly of the viral hepatitis, we have the viral hepatitis B prevalence ranging from 8 to 10% of the population. We also have the viral hepatitis C, alcoholic disease, and also the rising of muscle in recent years. So that is why liver cancer is really our great challenge. And when thinking back, what happened? What is the pathway? Why we missed the pathway from the viral hepatitis into the liver cancer? We find out that we have some sticking point, like we have the low prevalence of testing, and then we have the low prevalence of link to care, and we have a low awareness from the patient about how to attend in the liver cancer surveillance. So that is why liver cancer, we only see that it is in the top, but we missed the way how to manage it from the first is to detect liver viral hepatitis from the first phase. So that is our greatest challenge now.
Great. Manal, talk a little bit about Egypt. I feel like anytime we talk about Egypt and liver disease, it's almost a best practice in the way that Egypt has addressed hepatitis. When you look at liver disease or promoting liver health in Egypt, what are the challenges that you're facing today, having had success with hepatitis?
Well, I think that we've been most successful in bringing Egypt from being the country with the highest prevalence in the world to a very low prevalence for hepatitis C. Of course, that's a long history starting from creating liver centers, a national committee, political leadership, and political advocacy, and then eventually the national test and treat program that went out to test the whole population of adults. And then also children, we're going also to schools now, and we're screening regularly children for hepatitis C, and that's a very unique program. We also introduced the birth dose for hepatitis B only in 2016. We had introduction of the all three doses since 1992, but the birth dose was only introduced in 2016, and that means that we still had mother-to-child transmissions. We're still having almost over 1 million with hepatitis B. We have diagnosed and are treating in our centers almost 40,000. And then, of course, the metabolic-associated liver disease, and that's expecting to be on the rise, in addition to liver cancer, which is already on the rise because after treatment of all those patients who are cirrhotics with hepatitis C, we have a lot of liver cancer patients, and we have a very special program for liver cancer, introducing all the new therapies, as well an early detection program. However, we've recently, because we mapped also NCDs, during our campaign to test for hepatitis C, we found that only 33% of the population have normal weights. So we're going to face the epidemic of MASLD very soon.
Wow.
Starting a lot of awareness among the patients, among the public. We're talking about it a lot. Children, of course, I'm seeing a lot of obese children. I'm seeing a lot of children with steatotic liver disease now because of the junk food. And the government started a food program in schools, healthy food in schools, especially government schools. And it's starting very slowly. And I think that's really important. And we need to focus in the coming years on the healthy lifestyles livers.
Wow, that's a lot. And it's tremendous to hear. I feel like there are probably lessons learned. Let's stay with this on Dr. Manal, if we can. So often, I think, as patients, as advocates, as researchers, as practitioners, we get so focused on the challenges in front of us. What is the problem to be solved? I want to flip that. I want to take a look at that from the different perspective here and think, what have you done well in Egypt? We've mentioned hepatitis, and we'll come to Vietnam in a moment as well on this. Let's think about, best practices, in the way that I talk about it with our staff. What have we done good? What can we learn from in this? And I feel like there's a great opportunity globally for us to learn from each other. When it comes to Egypt, what do you feel like you've done well that might translate either into other areas or for other countries?
I think it's the teamwork from the very beginning and the multiple stakeholders engagement, including the politicians, the government, the media, the NGOs, and the researchers and physicians, as well as the patients themselves, because they have been advocates also, and they raise their voices, demanding treatment, demanding care. And I think this, among the many voices, prompt the government to start doing something about it. With the development of the National Committee for Viral Hepatitis in 2006, we took very concrete steps from the very beginning. We didn't have any budget. We didn't have any resources, only the resources provided by the government for treatment. And when we negotiated the prices of interferon at that time to 10% of the global price, the ministry at that time said we're going to pay only for the treatment, but nothing else. So we just created sort of a financial structure that was approved by Ministry of Finance, where the patient pays a very, very small amount of money that was distributed among those centers that we created to give the people an incentive for extra time work, to create the database that we've created and the whole network of patient database. And data actually prompted the government to do more and more, because once you have data, you can develop economic models, health models. You can show them that if you treat one patient, you're going to save this X amount of money in the coming years. And also, that also improved the advocacy among the politicians and among the government. And eventually, we had somebody who picked up the whole thing, which was the president. And we were planning, when we started DAAs, to treat people and test people over a period of 3 to 5 years to achieve elimination. He said only 1 year. And they got a catalytic fund from the World Bank. Everything was state funded, actually, until that year, 2018, when we had the catalytic fund to test and treat the 50 million adults and go for school screening. Now we have more than 70 million people have been screened, tested for hepatitis C, and all those who are infected have been treated. We're continuing with this program in schools. And I think it's the thing that the government speaks about all the time. Once they speak about a successful program in health, they talk about elimination of hepatitis C and what they've done. But not only this, we've also added the other pillars that were really important: the infection control, the blood safety, which is very, very strict now, and the injection safety, where we introduced the safety engineered devices in most of our hospitals now. And we are manufacturing in Egypt the safety engineered devices. So this is also one other successful story, because that would prevent other transfusion-transmitted infections and other infections transmitted through hospitals and nosocomial transmissions. So it was a whole plan that had all the elements, and I think all the stakeholders that worked with us helped us to a great deal. The media has been a great pillar, a great ally, and I think if you want to have a successful program, you need to have the media as your ally, because they can really change everything and flip everything around.
I have to say, as a Westerner, it's a bit mind-blowing to think that you have the media on your side, you have the political will, you have the economics. I mean, that's the perfect recipe for being able to address that. Dr. Hang, I want to go to you in Vietnam. So often in the West, when we talk about Asia, it's such a different model, if you will. What do you feel like in Vietnam that you have, as a country, or perhaps in your own experience, done well? What's a best practice? What is what's something that you feel like either other countries in the region or even globally that we could learn from that you have succeeded with?
Yes, so thank you, Professor Madan, because I think your experience is very inspiring. And when looking back to my country, so I find that our government and Ministry of Health also have a great effort, because we have made the vaccination program. So it is very good way. And also, I think we have persuaded our obstetrics and also the primary care level to pay more attention for the viral hepatitis. So at least now for the mother, for the pregnant woman, they will be tested for the viral hepatitis. And that is the first point to stop the pathway of mother to child transmission. And then the vaccination program is also very effective. The second thing I think we've done very well is because in Vietnam, we have a lot of the situation of OTC, the patients, very easy to get any kind of drugs in the pharmaceutical, something like that. But something we want to do is that to persuade and to educate the pharmacist that when the patient coming to them asking about liver disease or asking about the drugs to reduce the liver enzymes, we will persuade and ask them whether they have tested for viral hepatitis, and then use the rapid test and instruct them to do the rapid test for them and also for their family. And it also increased the prevalence of detection in the community. And the third thing I totally agree is about the social media. And I want to expand it into the digitalization, because now we have like a huge community of viral hepatitis patients on Facebook. They have a great, huge number of Facebook community. And the good thing is that we also have invited many experts in hepatology and infectious disease and primary care level to join in the network also. And when the patients, they raise a lot of questions, and the moderators will have to link with the experts, and also we organize the webinar to educate the patients. And it helps the patients and also their family a lot, and it spreaded the news really effectively. And we also have some achievement in using some smartphone apps for the patients and introduce the patients about the new technology, especially something non-invasive test that is easily for them to use. So somehow the social media and the digitalization make the gap between the doctors, the physicians, to the community closer. So that is what we have done in Vietnam in recent years.
Amazing. I mean, truly, usually we speak of social media as more of a issue, and you seem to have harnessed its power to be able to promote, educational capacity, which is truly how it should be used in this way. Let me wrap up with one question for both of you here at the end. In 2024, last year, by the time that we actually broadcast this, Global Liver celebrated its 10th anniversary. I want to pose a theoretical question for you. So 10 years from now, the year is 2034. What are the victories we're going to be celebrating in liver health in 2034, and what are the challenges it will have then? So we'll put on our science fiction hat and think in 10 years from now, what are the victories we'll celebrate? What are the problems we have solved? and then what will we be working on then at that point? Dr. El-Sayed, why don't we start with you again?
Yeah, I think the victories that we will celebrate would be elimination of hepatitis C at least. I cannot say B because B, we have a vaccine, we have prevention, but we don't have a curative treatment yet. So at least for C, because this is the only viral infection that has treatment, that is completely curative. It can cure it completely in more than 98% of cases. So I think that's something that we should celebrate. I'm not saying that I'm thinking we can celebrate. I think all countries should celebrate elimination of hepatitis C if they go for high-risk screening or nationwide screening or whatever the screening strategies they design. But that's something that should not be there anymore. It should be completely not there. It's the only virus that has treatment. None of the other viruses, none of them has a treatment, so has a cure. For B, maybe we will need a longer time. But I think the challenge would remain to be the steatotic liver disease. I don't think we'll be able to solve the problem of steatotic liver disease in 10 years. It's going to take much longer to find a treatment and also to change the lifestyle of treatment. I'm telling you because also I'm the president of Society on Liver Disease in Africa. With the food insecurity that's coming, MASLD is going to increase because people are going to eat more carbohydrates and more sugars to curb their hunger. And that's happening already in refugees and conflict regions. And we're going to see more and more steatotic liver disease.
Yeah, that's interesting. I mean, it's arguable that in the West that's how we got into this issue to begin with, was trying to overcorrect for addressing for starvation issues as well. Dr. Hang, let's go to Vietnam. Talk a little bit about 10 years from now. Let's put ourselves into the future. What are the victories we're going to be celebrating? What are you going to feel proud about in 10 years? And then what will you be working on?
Yes, so for me, I really wish that in the next 10 years, we can see the WHO goal becoming more realistic. So I mean that, for example, my country have a high prevalence of viral hepatitis B, but we didn't have the national programming of testing. So I really hope that we will have a national campaign of testing for everyone. And I think there is one more metric I want to add on the victory is that we can increase the percentage of the early liver cancer detection. Because I think like if we manage the good way of viral hepatitis B, viral hepatitis C, muscle or alcoholic liver disease. So if we want to see the in the decreasing percentage of liver cancer, maybe it takes a very long time, like 20, 30 years. But what we can see is that we will see the gradually increasing percentage of early stage liver cancer years by years. So it means that we have more and more patients linked to care and adherence to the surveillance program. So I really want to add on that metric, and I want to see it in the next 10 years.
Wonderful. Thank you both for joining us. All right. It's always great to be joined by two of the leaders in the liver field here, Dr. Desoky from Saudi Arabia and hepatologist practitioner, EASL Secretary General, and Renaissance Mountain Man, Aleksander Krag from Denmark. Let me pause there before I've said too much about each of you. Dr. Desoky, if you would say a little bit about your background and about what brings you here today.
Okay. Thank you for having me with you today. I am Dr. Mahmoud Desoky. I am a consultant gastroenterologist, and as well as I am assistant professor in the Faculty of Medicine. Through my career, I was working in the field of clinical services and medical education, and I have deeply involved in the advancing liver health, particularly in the era of hepatitis C in Egypt and tackling hepatitis C. Early in 2015, I launched the Egyptian Hepatitis Alliance, which is an initiative aimed to increase awareness, expanding screening program, and improving access to the new antiviral medication. Also, I lead an awareness campaign and organized many free medical convey to the area of poor population and poor patient, and help to educate community and support early detection of the disease. My focus on addressing liver disease, including also this rising incidence, and I can see it as a tsunami of muscle and MASH. And I am passionate about promoting the education, screening, and the treat approach. Even I called it ES&T approach for better liver health. And I am happy to be with you today.
Excellent. Thank you. No stranger to Global Liver Institute and a friend of the organization, Aleksander Krag. You would say a few words about what brings you here today. It's good to see you.
Yeah, good to see you too, Jeff. Thank you very much for inviting. Happy to support GLI on this journey here. I'm Aleksander Krag, a clinical hepatologist, professor of hepatology, and heading the research center here in Odense. Been active in research clinics, but also serving as EGLE Secretary General and working there with our global partners. So thank you for inviting me.
Absolutely. Let's stay with you on this. So this is the release of GLI's Liver Health as Public Health report. It's trying to kind of wrap our heads around what countries do well, what the challenges are they face. It's a little bit of population data, trying to just kind of get a better idea of the state of liver health. And so I'm wondering, Aleksander, if you can talk to us a little bit about Denmark, about kind of the European region that you've been involved with as EGLE Secretary General as well. What are the challenges to liver health that you find that kind of rise to the top of the priority list right now?
Yeah, so I'm privileged to be part of, I think, maybe a small country, but one of the richest countries in the world. And therefore, it actually saddens me a little bit to see that some of the things we could do better. I think we've done great with Hep C when it all came through. A lot of case finding, a lot of treatment, wonderful. But where we are lacking behind is actually some of the behavior-related diseases associated with obesity, alcohol. You know, in Denmark, almost 10% of the population engage in harmful alcohol consumption. We have 20% have a BMI above 30, and that combination is harmful. And there we see an increase actually in the burden. And I'm then a little ashamed to see that the societal response in terms of actually working against this, you know, with making some restriction, minimum unit prices for alcohol, restrictions for marketing, some of the things that we know works is actually not happening, and that's an issue. And again, looking at the European landscape, you can see all the alcohol-producing countries behave more or less the same. That you don't really do much to reduce alcohol-related harm, and you know, these days alcohol is responsible for 800,000 deaths in Europe a year. Not all liver, but so it is an issue, and we need to focus, and I think need to communicate stronger around that, because these diseases or this part of the liver spectrum is 100% preventable if we want.
So, Dr. Desoky, I don't want to stereotype, but when we think of the Gulf region, issues with alcohol tend not to rise to the top of most people's thoughts in terms of liver health. What are the challenges that you're facing there in Saudi Arabia and Egypt and kind of other throughout the Gulf region in terms of promoting better liver health? Let
me tell you from my past experience in Egypt and about the liver health in general. There's something was very important is the education. The problem with liver disease is the science is silent, and it is not. There is a lack of science of liver disease. Even with hepatitis C, we didn't show the patient unless they have cirrhosis or have complication, and this was the greatest problem we faced. Even when I started my campaign, I put the priority is to educate. And education was not directed only for the patient or for the community, but also for the primary care physician. I was very dedicated in teaching the student and the intern and the medical resident how can they examine the patient and find any early sign of liver disease? Because if they are not educated well about the sign and the method of diagnosis, it will be missed from them. So I think the lag area or the weak area for liver disease in general and for muscle or hepatitis C was education. We have to educate the community. We have to educate the primary care physician who see a lot of patients, who sees a large number of patients. So education is the first priority. And even I started this approach, which is ES and T, educate and then screen, and then you can treat. So when we educate the patient, the community, they will become aware, and you don't know how it was very effective in the era of hepatitis C.
Mhm.
Educating the patients that is there is a science, there is a treatment now available. It was very important. Now, because the patient was first, they know that the medication only was interferon and ribavirin, and it was disappointing for many of them because the success rate is, as Dr. Alexander can agree with me, it is not all, it is only from 50 to 65%. And this was very not available or not accessible for many patients. And the other idea, it is not successful for many patients. So I think in not only in MENA area, the North African or Gulf area, but also it is globally. The education is important, and the awareness of the disease and the disease process is important. For muscle and MASH, it is important to screen the high-risk population, who is the patient with obesity, diabetes, and metabolic syndrome.
I think, I want to look at this from the other side of the equation on this. So often, it's justifiable. We get caught up in the magnitude of the problem, in the, as you said, the tsunami that faces us. We all see this coming, whether it's looking at actual prevalence numbers or projected prevalence from the rise in other chronic diseases that we see. Dr. Krag, I want to go back to you and flip this on its head from what we usually talk about. What do you think in Denmark or in Europe, what do we do well? What do you think is something that is exemplary? What's a good approach to this and a good program that we should be talking more about?
So I think one thing we can learn from Europe, where we have the advantage that most countries are driven by public health systems, which mean that it's free, it's accessible for all. We know with exactly these diseases, also Hep C, Hep B, that is also very much associated with migrant health. We need to see, but also obesity, alcohol is also have stigmatized nature and socioeconomic issues. So there, I think we have an opportunity actually to reach out to the more marginalized, vulnerable population that was otherwise not reached out to. And we give some of the example of countries that has actually done well. If you look at what happened in Scotland and Ireland also, well, they put minimum unit pricing in. And it's interesting to see that you can then reduce the alcohol consumption overnight by just changing the price. And that translates directly into less alcohol-related harm, particularly among the young. Many people don't know that the most important risk for death among the young are actually alcohol-related, not because they get liver disease, because they get accident. But in the long run, they get liver disease. Because that's some of the things what we can do. And I think we can, to my knowledge, there's not yet anybody who actually implemented tax on sugar sweetened or marketing towards kids. We should protect our kids against these because, at least 10% of the kids have steatotic liver disease. That's not okay. We can do better. So why don't we work with school food, with improving or forbidding marketing towards kids to protect them? Because they will, we see sometimes kids in their early 20s needing a liver transplant for something we could have prevented.
Oh, you're speaking to my heart. I spent the first part of my career specifically working on food marketing towards children, and we see so many places where even things like front of package labeling work so well. This is great stuff. Dr. Desoky, I'm wondering, we mentioned earlier the Egyptian work around hepatitis. In this area of liver health, what do you feel like's done well? What's something that we could learn from the Gulf region or the MENA region?
What we did well, because was a very profound problem in Egypt, and there is a driving force for all of us, the physician, the health advocate, because we see how much the patient is suffering. So it a comprehensive and collaborative work from all community members, not only physicians. Okay, but I learned more a lot about when you incorporate, and even I was telling everyone, this is your responsibility, and you have to act. You have to be part of this campaign. You have to be part of this regulation. What happens? There is many small models of hepatitis C treatment was through all Egypt, and then becomes a national campaign or a national direction for the treatment of hepatitis C in Egypt is called Saving a Million Life, and that is what collect all this effort and help us to get rid of hepatitis C. The problem with other liver disease is, as Dr. Aleksander said, it is our health, our lifestyle, and people habits. Now, you're trying to push people to go a health lifestyle, which is not easy. And if they are not educated well, they will not follow what we are telling them.
So one last question here. I want to do a little round robin with both of you for the questions. Aleksander, we'll go back to you for this. Is in 2024, Global Liver Institute celebrated our 10th anniversary. And I think you were there at one of our celebrations at the EASL meeting. We appreciate you coming by. 10 years from now, in 2034, or if we think about that, 2034, what do you think the victories are that we're going to be celebrating in liver health? And what are going to be the challenges then? But I want to emphasize what are the victories. What gives you hope? What are we going to be look forward to? What are the victories we're going to be talking about in 2034?
I'm always very optimistic, very positive, and I think there's good reason to be that. If you look at the steatotic liver disease spectrum, alcohol, cardiometabolic risk factors, and the mix, we're at the brink of a transformative change, that's for sure. Because now we got the first 2 drugs with positive phase 3 trials, and we got a ton of new drugs. So in 10 years, we will have on the shelf, when people come to my clinic, I'll have several options. Some drugs will work for some will not tolerate, but I have a lot of things to do. And that's only part of it. That's a very important message. We cannot treat us out of this, but this will bring a lot of activities in. That would also mean that we can work with awareness. We can work with health literacy. Many people have not much information or understand what the liver do or not do, and how do you actually take good care of your liver. So I think with that, we can drive the change for both the policy, for prevention, and integrated liver health. These drugs are not just alone. It should be together with physical activity and diet changes. And I'm particularly also worried about the next generation, the protection about the kids. And I'm sure if we all go together, we can make policy change and actually have ban against marketing unhealthy food towards kids, and hopefully break the obesity epidemics among kids. And we don't need all kids from their 10-year-old to be in a drug for the rest of their lives. This is not the direction to go. So that's my vision. Of course, then new issues will pop up, but let's see. I think we now got several tools, and we actually know what to do. We know how to do it. Now it's just about that we all focus on it and get it done and stand together.
Excellent, Dr. Desoky. 10 years from now, it's a little hard to imagine. 10 years seem to have gone so fast, the past 10 years. But 10 years from now, what do you see the victories that we are celebrating in the Gulf region when it comes to liver health, and what are the challenges 10 years from now?
You remind me with when we was in 2010, and we was trapped in this increased number of hepatitis C patients and liver cirrhosis, hepatocellular carcinoma complication. We was living the story from the start of discovering that the patient is having hepatitis infection until we see the morbidity and the mortality. And we didn't, we was not able to imagine we will have a victory in 2013 when the first direct antiviral medication, was came out. But I will keep regarding the current challenges we are facing in the treatment of muscle, and in spite of this increasing incidence of obesity, metabolic disease. But as Dr. Aleksander said, that we have tools and we have many options for treatment of obesity and metabolic diseases. So I think there will be another victory for human against the disease in the next 10 years. I think is awareness and the new medication for obesity and the rising of new medication for steatosis. This increase or this can break the circle of the disease. And we can, as you said, we can inshallah come after 10 years and said we are victory and we have another victory of humanity against the disease.
All right, Dr. Mahmoud Desoky, Dr. Aleksander Krag, thank you so much for joining us today. We really appreciate your insight and your continued partnership with Global Liver and your leadership in each of your areas, certainly. Wow, that was a lot, and that was really great. It's really so, cool to be able to have the technology these days to bring in all these amazing, players and the amazing leaders in liver health worldwide. Granted, we had a couple of connection issues with our friends from Nigeria, but I think that's kind of exemplary of what we're dealing with in liver health generally, isn't it? That we're trying to make the connections, trying to get less compartmentalized as well, where you can kind of see the differences, but also see the commonalities that we have in dealing with these issues. Lily, you've been worldwide, and you've been at the heart of this project for a couple of years now. What are your thoughts?
Yeah, I think that some of the challenges are kind of parallel to the challenges that we're seeing as we're interviewing and talking to people from different countries. We're facing a lot of the same issues, but the resources that each community has, that each country has, are so different. So I think it's helpful. It's helpful to see kind of what best practices are, but then to have those conversations to figure out how they might fit back into each community.
Yeah, I really like that. I mean, I think we often get caught in this mentality of, because so many countries follow the lead of the Food and Drug Administration here in the U.S. for approvals and clinical trials and all that sort of stuff. There's this almost kind of false notion that there's a trickle down, if you will, is that that the West is here to help. And we see, especially in Egypt and how they approached hepatitis, that we have a lot to learn from these countries. And so as we can get better data, better examples, as is in the report that we have coming out, or that has already come out, how we can better address and truly learn from each other. Sugar sweetened beverages are an issue almost everywhere. We see metabolic syndrome really rising worldwide. We are in this together. And I think it really, really speaks to our need to learn from each other and work with each other that much more so. Yeah.
I mean, the science is pretty much the same no matter where you go, but the details and the epidemiological data is different. So yeah, there's definitely a gap in that on that side.
All right, we'll be back next month to focus on rural areas and rare liver diseases as part of GLI's Rare Liver Diseases Month. Lily, did you know that a disease is only considered rare if it affects only less than 200,000 people?
In what population?
Well, in
the world or in the country?
In the country.
Okay.
So,
No,
so
I didn't know that.
almost 250,000 of people can have a condition and it still be considered rare, which means it's likely under-resourced and undertreated in that. And so if you overlap that with the many issues around rural healthcare, and I'm really looking forward to learning more when this episode drops in February. Now, for more information about liver health and to find a copy of the Global State of Liver Health Report, find us at globalliver.org. And be sure to join the conversation at our socials on Facebook, Instagram, and LinkedIn. You'll see the video version of this on YouTube, but we're also available on the latest podcast platforms, Spotify, Apple Pod, Pandora, or, wherever you're listening. Now, depending on how you found us, make sure to leave a comment, like, and subscribe so you don't miss any of the upcoming episodes and the great conversations ahead. A thumbs up may not seem like much, but it helps us grow awareness, education, and build support for liver patients worldwide. I'm Jeff McIntyre, and on behalf of producer extraordinaire Lily Bainick and the team at Global Liver Institute, we'll see you next time.